What are turbinates and what do they have to do with rhinoplasty? Turbinates is probably something most people have never heard of. If you look inside a pig's nose or a dog's nose, it's pink and clean. A dog doesn't have a Kleenex or a neti pot. The nose is sort of like a self-cleansing oven. If a piece of pollen enters your nose, a piece of dust, what happens is there's sort of a conveyor belt of mucus on both sides, thin, clear conveyor belt of mucus that's propelled from the front of the nose to the back of the nose all day long, propelled by these little cilia. That's why the nose looks kind of shiny. And there's a natural thing called the nasal cycle. If one of the nasal passages becomes dried out and that conveyor belt of moist mucus gets dried up, then what happens without you even thinking about it or knowing about it is this little organ on the side called a turbinate will enlarge and swell up and nearly obstruct that nostril. Simultaneously, the opposite turbinate will shrink down and you're kind of alternating breathing through one nostril or the other like a slow windshield wiper. When on any given day, if you're elevated, so those blood vessels are above your heart and you're distracted by conversation or TV or driving, you're not even aware of that. About the only time people are aware of their turbinates, let's say you've got a really bad cold and a rhinovirus has infected that and causes it to be greatly swollen and enlarged. And then you lay down flat, and because you're laying down flat, the blood leaves your heart and fills up that turbinate even more. You get that experience where you're laying on your pillow and all of a sudden you can't even breathe through one nostril or the other. And what that is those turbinates are engorged. The turbinate tissue is where a lot of the cells that overreact to pollen and stuff live. So when we perform a rhinoplasty, it's more than half the time. What we wind up doing is we push those to the side. There's a little bone in there. We push it to the side. And then they're very abundant. They're bigger than they usually need to be in some cases. And so what we do is we cauterize the front edge of that. It doesn't mean you'll never be allergic again, but it typically improves your allergy reaction a lot and reduces your dependence on things like Nasacort, Rhinocort, nasal steroids, and decongestants.